Hi, everyone, and welcome to today's edition of Stanford Live. We're super excited to be here today with Kimberly Davis, who is one of our case management managers. She's here to chat with everyone about what it's like working in the case management department here at Stanford, what it takes to get a job here with us, career advancement, all the ins and outs. So any questions that you have for her, drop them in the chat. She is so excited to get to chat with a couple of you today and just tell you more of why she loves working here. So without further ado, I would like to introduce Kimberly to tell us more about her.
Thanks so much, Carly. And I am so excited to be here today and be able to share my experiences with you. A little bit about me. I started my career not in nursing, but actually in the business and financial consulting area and human resources and also project management. And after about those 15 years, I realized I had a different vision for myself. And I started looking at other opportunities, and nursing just popped out to me. And I'm so glad I made that decision because I love nursing. And so I've been a nurse now for about 10 years. And my first position was with a level 1 trauma center in Tampa, Florida. I worked as an ICU nurse and also hospice. I had those positions for maybe about 4 or 5 years, and then I moved into clinic care coordination, which I really think propelled me for my case management career. I've been at Stanford now for 2 years, 1 year as a frontline case manager, and then I was promoted to manager of care coordination. The teams that I actually work with are the emergency department, clinical decisioning unit, observation, and surgical services.
Thank you so much for the introduction, Kimberly. And then I also wanted to introduce Sherry Smith, who is our senior talent consultant here today. She'll be able to answer all those questions about onboarding, applying, interviewing, benefits, all of those fun things. So Sherry, if you can just give us a brief intro about why you joined Stanford and why you love it here. Sherry, your mic's off.
So much for being live. Thank you, Carly. Hi, everyone. My name is Sherry Smith, and I am one of the senior consultants with the talent acquisition team. As of this week, I have been with Stanford for 2 years and 1 week. And my reason for being here is because Stanford has held such a personal level of hope in my heart, dealing with a family member with a chronic disease and going to Stanford. His feeling was is that he always felt that Stanford rolled out the red carpet for him, and with that level of service and continuity of care, what better place to work and bring in nurses, supportive team, allied staff to service people in such a need.
Thank you, Sherry. Well, Kimberly, I guess let's get started. So I think when people think about case management, a lot of them, there's so much information out there, but sometimes people don't know, is it bedside? Is it not bedside? What does a case management role look like? What is the type of interaction that you're having with your patients? What exactly goes into the day-to-day life of a case manager?
Those are great questions. And yes, I get those questions often. So, in general, case manager is kind of like three components that goes into the roles, and I like to bucket them out. First would be clinical coordination, and that really entails meeting with the patients and families at bedside, getting an understanding for what their home life is, what currently they may be going through and why they're hospitalized. Have they had other services prior to their hospitalization? So, really sitting down and getting that information from the patient to understand kind of where they are right now. While at the same time, you are, as a case manager, considering that what needs they may have when it's time for them to discharge. The second bucket I like to talk about is utilization review. And that is when case managers look at a case clinically. We have an application that most hospitals use where we use that clinical information to help determine first, is that patient someone who really needs to be admitted to the hospital? And second, if they are going to be admitted to the hospital, what level of care? Is it acute? Is it critical? And then the third bucket I like to kind of look at with care management is transition or discharge planning. And that's when a patient is leaving the hospital and they could be going home with no needs, or they could be going home and need home health or infusions. They may be going to another facility for additional care. And so a day in the life would be really wrapped around those three buckets, starting with the patient list you have for the day, going to rounds, talking with your patients, and then helping them with their discharge process.
Awesome. So when someone's in this role, about how many patients are they working with each shift, and what do shifts compromise in the case management world? Is it a 12-hour shift, an 8-hour shift? Is someone looking at working nights or weekends? Is it fully daytime? Obviously, being acute care, you're in a hospital system, so you're constantly needing, those to be available around the clock. Can you kind of walk us through what someone can expect in this role kind of day to day in terms of patient caseload?
That's also a really good question. So caseload may differ depending upon the acuity of the patients that you are managing. Specific to the emergency department, which is also composed of the clinical decisioning unit, where we have patients who are there for 24 hours or less. We also have our observation unit, and patients are typically there for 2 to 3 days, so anywhere from 48 to 72 hours. And so the load can be quite different if you're working in the emergency department. Specific to the areas I just mentioned, ED, CDU, and OBS, those positions are 10-hour shifts, and they are 4 days a week, primarily with rotating weekends. If you're looking at more of an inpatient position, we do have positions that are 5 days a week for 8 hours, but we're overall looking at kind of revamping our staffing model and starting to look at moving more of those positions into 4 days, 10 hours. We actually have a pilot going on with one of our teams right now, and we have a lot of successes out of that. So in general, if you're inpatient, we try our best to keep your patient load somewhere between 18 to 20 patients. But again, we look at acuity of your patient load to make sure that it is appropriately assigned.
So once you're on the unit and you've got this position, what's the culture like? Being a case manager, you're integrated into another unit. You're ED, you're in the CDU. How do you help your case managers kind of integrate with those other bedside nurses and the other staff to kind of build that culture, make that an inclusive culture, not just within that unit, but also within the case management family? Do you guys do activities outside of work? Do you do celebrations at work? How do you kind of keep it so it's a cohesive family?
Oh, I love that. So specific to the ED area, I do have huddles with the team 3 times a week. And during those huddles, it's not all about, the numbers or patient load, which are very important, but I also like to spend that time getting to know the team. And we have an event coming up, I think in another week, where it's an outing. So away from the Stanford campus, and we plan to go out and just have a really great evening together. But when it comes to how we incorporate and have that cohesiveness, it is the huddles. It's also me offering the opportunity for anyone on the team to come talk to me if they have questions or concerns about anything. When it comes specifically to the emergency department itself, the team is integrated into the nursing station. So the doctors are there, the nurses are there, and actually sometimes the patients are really close by. And I have started to forge a relationship with ED leadership where we're looking at different avenues to incorporate case management more into the workflow that is occurring in the ED. Same with the CDU and same with observation. I do have an inpatient unit as well, surgical services. And for them, they also are integrated into the units in which they work. So they know the doctors, they know the charge nurse, the primary nurse for that floor. And we utilize our time together the same way as I kind of explained with the ED. We have huddles twice a week. We do a lot of sharing, escalations, things of that nature, and then just also getting to know one another. I always do one of our fun things, a question of the day, and everyone seems to love that. So we like to incorporate a lot of activities into what we do outside of just the work, because I think that's really important that you are in an environment, in an organization where you feel connected and where you also have a good time. It can be tough sometimes, it's a little stressful. So I try to do my best to alleviate some of that.
Awesome. And we're starting to get some questions. So I'm going to pass this first one to you, Kimberly. We had someone ask, how do you coordinate care between shifts, especially for patient discharge, to assure that the patient does well and avoids rehospitalization?
Oh, that's a great question. And actually, it ties back to something I didn't answer for you, Carly. So, specific to case management, inpatient, those hours are until 6 p.m., 7:30 in the morning until 6 p.m. It just kind of depends on your shift. So, it's not 24/7. And then when we're considering the emergency department, we just started a new model where we are working towards a 24/7 shift. So the positions that I have open are for the later and evening. When it comes to readmissions, that is a huge component of what we attempt to do. We don't want people to be readmitted to the hospital. We want to ensure that we are providing them with everything that they need for great recovery and transition to their next destination, whether it be skilled nursing or home health. As I mentioned before, we also have our case management assessment, and it's pretty comprehensive. So we try to get as much information up front as we can, and we continue to follow that patient, of course, throughout their stay here with us. And then as we identify potential needs, immediately engage the patient and family members and make sure they have enough support for that recovery home or at another facility.
Awesome. And then we have a question. Is this position hybrid, in the office, or remote, or what opportunities do we have available based on that scheduling?
Sure. So the position is on site, and we find that it provides the best patient experience when we have someone actually going into the room, seeing the patient, being able to empathize with where they are right now and sitting down and having that chat with them. And then we also follow up face to face. So all the positions that we currently have are inpatient or in hospital, sorry.
No problem. And then another one, do we have any case management opportunities and outreach are you aware of, Kimberly?
I'm sorry, ask one more time.
Are there any case management opportunities and outreach?
So specific to outreach, are you speaking more to like discharge planning, or not discharge, once a patient discharges and we do outreach there?
Marcos, if you're still watching, if you can add some additional details so Kimberly can make sure she's getting you the best answer. And while we wait for that, the questions are pouring in, Kimberly, so I guess we'll keep going. The next question is, does your case management assessment include socioeconomic factors that can impact recovery and their future health trajectory?
It definitely does. And when we have identified those potential factors, we also engage our social work team. So it's case management and social work. We are a team. Every case manager has a social worker that they are partnered with. So if we, again, identify those needs, we make sure we pull the social worker in, and then we both work with the patient to help them in those areas and provide resources or connect them into resources in the community.
Awesome. And then our next one that just came in is the UR on-site or off-site? Is the UR team responsible for contacting the providers to change levels of care if necessary, or does the URCM notify the unit case manager to contact the physician?
Ooh, I love these questions. You all have done your homework. Yes, so UR here is not a triad model, being it would be the UR person, the nurse there, and then the case manager. Right now, we only have that model for that one particular team I was talking about earlier, where we are doing kind of a pilot, where we have 4 10-hour shifts on the inpatient side. And so they have kind of that triad model. All other UR is actually done by the case manager. And so the case manager then is responsible for, during rounds, identifying those opportunities where either someone needs to be changed from an inpatient to an observation status, vice versa, or maybe the patient no longer meets status to be in the hospital after several days. And we also communicate that to the treatment team. So we are in close contact as case managers with our treatment teams. We engage on a daily basis, actually more than a daily, several times throughout the day, because we do round with our treatment team. So yes, we are the ones, the case managers are the ones who have that conversation with the physicians and our other medical providers.
Awesome. Thank you for that, Kimberly. And I kind of want to pivot a little while we wait for more questions to come in. So we have different case management opportunities available, and I know many watching have probably applied for our case management opportunities, but didn't receive a call back, an interview. So what are the requirements? What are you looking for in an ideal candidate for case management? And for those that don't have any case management experience, what do you recommend to them? If it's a bedside nurse looking to get out of bedside, wanting to move into case management, what's a good way to get their foot in the door of case management? And if it's a new grad, a lot of times I see, masters of nursing and case management. Do they need to have previous experience, or with that specific degree, do we sometimes take new graduates?
Yes, so specific to being a case manager. So first I want to kind of tackle, like, if you don't have that experience, you're a nurse and you would like to kind of break into the role of case management, I would recommend a few different things. First, making sure you truly understand what a case manager role is, like what we would do every day. Sometimes I have noted in interviews with individuals who maybe don't have as much experience with case management, may not have a full understanding. And so some suggestions would be things like, to kind of attain that knowledge base, would be to contact maybe your local ACMA, which is American Case Management Association. They have a ton of resources. They also have a lot of events locally. And here, our Northern chapter, we actually have an event coming up this Friday. So kind of like understanding that role, making those connections, and then looking at opportunities where you can, if it's not directly into case management, maybe as a clinic care coordinator and an outpatient clinic, it will kind of give you a nice baseline of understanding. It is different than working in an acute hospital setting, but I definitely think it kind of starts to move you in that direction, as it did me. You could also work in organizations such as managed care. So that would be any HMO or PPO, any organization that has like an internal case manager. That's also a great way to kind of get your feet wet with case management. In regards to what particular I am looking for, we look for in that role, we are looking for someone with experience. So a couple of years is great. If you are a new graduate and you are coming from a case management master's program, we are happy to have you here. We actually have several staff members who came directly from an MSN in case management, and they have absolutely thrived in this environment. So we are looking for those types of individuals, as well as someone with experience, if not truly case management, like I mentioned, care coordination in a clinic, managed care. And if you do have that case management experience, an acute level hospital will be great. We're very fast paced, a lot of patients, very complex, but the environment here is wonderful to kind of grow your case management skills. So I hope that answered all the components of that question. If I missed something, let me know.
No, I think that's great, especially when, I've noticed a lot of times on our social media, people will say, oh, I would love to work in case management at Stanford, but I don't have the experience. What advice can you give to get my foot in the door? Or what do I need to do to work up to gain experience to be able to work there? So I think that's some great advice. And then we had another question come in for you, Kimberly. What are you most proud about your team, and what differentiates your case management team from others here at Stanford?
Ooh, that's a compelling question. I would say what really stands out to me with both my inpatient and outpatient teams would be their sense of camaraderie amongst one another and advocacy for the patient. So that's kind of two answers, but they both stand out to me. When one particular case manager has a really heavy load, like today, I had someone with a very high volume of patients we weren't expecting. Someone else immediately jumped right in and said, hey, I'll take like 10 of your patients. And then on the flip side, when it comes to our patients, I have never seen such a group in any organization. I've done case management in a few other places, but truly the advocacy that we do for our patients here is just phenomenal. The patients are why we are here. They are the heart of what we do. And both teams really make sure that our patients have exactly what they need to recover and get back to the best that they can. So I really enjoy those two aspects. And I see it all the time with both teams. And I think they do stand out amongst others, but don't tell them anyone else I said that, any of the other managers.
I love that. So once you're working here and you're on this amazing team, what are career growth opportunities for those once they're here? What can they expect as far as their career ladder within case management?
So I would say I'm probably a very good example. I started out here on our medicine team, and I was a frontline case manager. And after a year, there were several opportunities in management for our case management area, and I decided to throw my hat in, and I got the position, and I love being here. In general, Stanford has so many opportunities available. So you also, as case manager frontline, we have so many different committees that you can participate in. We have a shared leadership committee who's doing wonderful work looking at a lot of our workflows and programs and figuring out better ways to do things that we've done in the past, and also bringing in some new ideas and innovation. Within the organization overall, there are different committees you can join, and not necessarily always 100% specific to your role, but just committees to network with other individuals. And internally, one thing that I do with my team is when I have one-on-one sessions, I ask them, what are things you're interested in doing? Some will say education or getting CEUs for whatever they're looking to accomplish or get certification in. And so when I get that information, I keep it. And when there are different projects and we're looking for volunteers, I tap those individuals who have put their hand up and say, hey, I want to do something different or do a little bit more. And so that's really important to me as a manager, that I do understand what each member of the team has as their strengths and then where they like to kind of move on. And I really work on helping them get to that point. But I feel like at Stanford, I mean, it's so open to whatever you can consider as your next step, it is here. It's a great organization to be in. And in my 2 years, I will say, I feel like I kind of found my home. So I really enjoy working at Stanford.
Well, and just in time, another question just popped in for you, Kimberly. Someone is asking, what enabling technology do you use to help your case managers? I don't know if that's enough information.
I think so. Well, so there are a few things that we do. Right now, we use Interqual, and it's integrated into Epic, which is the system that we use. In addition to that, we are currently also implementing a new referral platform. The referral platform that we had before just didn't offer us enough to help our patients. And so we have a new platform that is slated, I think, to go live, if not the end of this year, then definitely early next year. We are looking at what opportunities are available with AI for UR. And so that's very intriguing. I mean, that technology, I won't say is new, but it's kind of new to us. And we're looking at that as a way to assist. And we're always looking at different ways to manage our workflows to be more efficient. I recently worked with the emergency department case management team, and we developed an entirely new workflow where in Epic, they're able to see everything that encompasses their work every day in one screen. And so we're always looking for that opportunity, and I'm always asking, what can we do better? And so when I get the response, and if it's a possibility, then we just kind of go for it. I mentioned that we have Epic as our primary system, and the social work case management department actually has Epic consultants devoted to us. And so we meet with them on a weekly basis to talk about different innovative ways to make work a little bit better and more streamlined.
Thank you for being so thorough with that. Well, I'm going to let you have a little break, Kimberly. I feel like you've been talking so much. Sherry, I'm going to get started with you. So for anyone that's watching and they're interested, but maybe they have some questions about how the application process works, or they just want to learn about, since we have so many openings, or not necessarily so many, but different specialties, what's the best way they can reach you? And what are kind of some of the selling points? Why pick a case management role at Stanford versus maybe one of our competitors in the Bay Area or even in California in general? What can you tell them about, why pick Stanford?
Sure. Thank you so much, Carly. One of the things that I find to be very unique with this team, and I think that it's great on my end as a recruiter as well, is that Kimberly and the group of case management managers work together in tandem. In terms of applying for a position, if you apply to one of the case manager roles, your information will be reviewed in terms of meeting the experience, licensure, as well as any other certifications that are needed or required for this role. Of those that meet that requirement are forwarded to the hiring manager, and that hiring manager and that team will do a review, a phone interview as well. And if you move forward, then you would go into a interview, which is usually virtual. One of the things that is beneficial for you as the candidate is there are times when the hiring managers may collaborate and have the interview done simultaneously. So instead of having to go back for one interview and then another with another team, you're able to actually conduct that interview for more than one team at one time. If you are not selected, and I think this is also important to know, if you are not selected, that doesn't mean that there goes the end of your candidacy. I do review candidates to see if there are other opportunities available for the team. If you're looking for work in case management, those case managers also work together, and it is quite often that they will refer a candidate to another hiring manager that has an opening. I hope this answers the question.
Absolutely. And then can you tell us a little bit more about our benefits? Is there any sign-on bonuses for case management, especially if someone maybe sits in Colorado or New York and they're thinking, I want to make this move to California. This sounds like a great opportunity, but I'm going to need a little help getting there. Want to know what the retirement package is like. What if I have my bachelor's, but I want to get my master's? Do you offer tuition reimbursement? What are some of maybe those more perks that you tend to have candidates asking you?
Sure. Thank you, Carly. So one of the unique things that's going on right now is that we are offering a signing bonus for external hires that are brought into Stanford. And that is for any position that is full-time, and actually some of our part-time roles as well. That is a $10,000 signing bonus. One of the things I do want to mention, because Carly, you did mention if someone is relocating, we do not pay both relocation and signing bonus, but since the signing bonus is larger than that of relocation, we offer that to you. And that is paid out by the second pay period that you start with Stanford. In terms of education, we do have a very lucrative education reimbursement package as well for employees, and that would also include if you're going to get additional CEUs. In terms of our benefits, we offer benefits to employees. This would be a non-represented role. And we offer benefits that start the first of the month following your qualifying period. So usually that is the first of the month following your start date of employment with Stanford Healthcare. Our benefits consist of medical, dental. Our medical is with Stanford, an HMO with Kaiser or with Aetna, and that's your choice. And then we have the dental, vision. We also have additional benefits available for pet insurance, for identity protection. What else can I say? There's quite a bit. So our package is available. I'm always happy to share that with candidates even before they get to the interviewing process. I think that the benefits are something that you need to know about in order to decide if Stanford is right for you as well. So I'm happy to share that information with you at the time of application or prior to going into your interview. And if you have any questions, don't hesitate in asking.
Thanks, Sherry. And for those of you, depending on what platform you're on, at the conclusion of this, I will go in and tag Sherry's contact information so that you can reach out to her, get more information about our rewards, more about that sign-on bonus, or just additional information about maybe which position works best for you. But we are starting to come down on our time. And it's been such great questions today that I think have really helped explain more about our case management role. Kimberly, I did want to ask one final question for you to answer. For anyone out there that's sitting on the fence about applying for a case management role with us, what would you say to them to give them maybe that little nudge to just go ahead and get their application in? And why pick Stanford?
Well, I would say first with case management, in the 2 years I've been here, we have done so much work at really listening to our team, listening to leadership, and making sure that we understand the needs of the team, our patient, and what leadership and how they want us integrated into the hospital, the healthcare system itself. And so with that, we've made so many remarkable changes. We have so many left. And we just continue to evolve every single year. There's something new. Also here, we have a lot of connection with the ACMA, the organization I mentioned earlier, American Case Management Association. And so we actually offer for case managers a free membership so you can have those resources available to you. And I think that's extremely important, being connected into an organization that understands the specifics of our profession, and then having the resources such as seminars and things of that nature available to you as well. And so in general, I would say case management here is becoming more and more innovative every day. And like I said, we've been evolving over the last few years, and we are also seen by leadership as strong partners, of course, in the vision at Stanford and for our patients. When it comes to Stanford itself, so first off, I have to say, the campus is beautiful. Just walking to work every day, I think, oh my gosh, I'm here at Stanford, and I did not ever anticipate I would be here. It was thanks to Carly, who found me on LinkedIn and talked to me about working at Stanford. And now that I've been here, I just enjoy the community and the culture of Stanford. There are so many, as I mentioned before, organizations here available for you to participate in, so you feel like this is your Stanford family. I am a co-chair in a group called the BEAM team. They're an employee resource group. And the BEAM team is a team that is for, not for, but it's Black employees. This is the acronym, Black employees for advancement and mentorship. And it's a diverse group of people who have kind of the same focus. My area where I'm co-chair is specific to community outreach. So I just think there are so many opportunities available here and available for you to connect with the community itself. And so that's why I think you should apply. Go ahead, why not?
I loved that. And thank you for mentioning the BEAM team. Sometimes I forget we do have a large group of employee resource groups available. And again, for anyone watching on our platforms, I will link our total rewards page. You can see a little bit more about benefits, and then also the different employee resource groups that we have here. We have our Latinx and allies. We have the BEAM team. We have working parents. Just so many different ways to get involved. But for everyone that watched today, thank you so much. Like I said, if you're interested in learning more about these opportunities, I'll make sure to include Sherry's information so you can reach out to her, as well as links to go ahead and apply for the openings that we have available. But thank you for spending your lunch hour with us. For everyone watching this after the fact, thanks for tuning in. Definitely ask questions. We're happy to keep answering them. And we will see you guys next time on the next Stanford Live.